Here we go. Let's get into Black Facts.
The coronavirus has highlighted public health vulnerabilities, structural racism, and disparities in the Black community. This is not new news. Our community has always been at risk for as long as our ancestors can remember. And as the coronavirus narrative continues to change, we must evolve in our thinking so we can protect ourselves. Blacks are still dying from COVID-19. As early as May 2021, the COVID-19 deaths were younger and more disproportionately Black than those who died of COVID-19 throughout the pandemic. And Dr. Anthony Fauci has said that those who are still dying of COVID-19 are overwhelmingly unvaccinated. I decided to talk to some community members and hear their perspective on the COVID-19 vaccination and learn why they have or have not decided to get vaccinated. Please welcome my guests, Eddie Harvey Jr., Lauren Madison, Nikita Hooper, and Shore Denny. Today on Black Facts, we're going to talk to a few community members and learn their perspective on the COVID-19 vaccine. It's not my intent to sway you either way. I just want to provide a space for us to have an open dialogue about how we feel about the vaccine, free of judgment, just a conversation. Your decision whether or not to get the vaccination is uniquely yours. So let's get started. Okay, welcome everyone back to Black Facts. Today we're going to be talking about the Black perspective on the COVID-19 vaccination. And my guest today is Mr. Eddie Harvey Jr. I'd like to welcome him. Welcome, Eddie.
Thank you, Michelle, for having me. It's a pleasure to be here. Thank you.
Absolutely, you're welcome. We're happy that you're able to come and share your perspective. So Eddie, can you tell our viewing audience a little bit about yourself?
Definitely. So I am a husband, a father of two children, 10 years old and 13, just turned 13 actually. I work in the health field as a nurse in our community, and I'm a man of faith. So that's who I am predominantly.
Okay, good. Thank you so much for sharing. So I want to jump right into it. What was your initial reaction when you learned that there was going to be a vaccination available?
So if I'm being honest, my initial reaction was, it's happening way too soon, way too fast. And I think I'm gonna wait for the next round so I could see how it goes.
I kind of felt both excited but also hesitant, just because the way the global pandemic has started all the way up into this point, everything's just kind of been all over the place. And then the fact that, like, facts about COVID have been one thing and then the other, like, during this whole entire time. So when the vaccine was being talked about, I was like, okay, cool, like, we can get on this medically. I felt like, us as a country, like, we'd be better at, like, coming up with stuff medically. So I was, like, excited. But then, like, when things started to come out about it a little bit, like how things weren't, like, necessarily FDA approved and stuff like that, it kind of put me on the fence. So I was, like, excited, but I was also hesitant.
Okay. So what would you say is the most surprising thing that you've learned since the vaccine has been made available?
Two things that go together. One, that it was more than one shot. And two, that wasn't the end, right? That it didn't cure it. Now, I did some research after, and I looked up scarlet fever and what our country did, to immunize the nation. In a week, and it looked like, it was like, bam, it happened, and I looked at polio, how they did the vaccination of polio, and I'm looking at how they're doing this, and it just doesn't seem right. I just don't trust the system. And the fact that you might have to take it again, is this going to be like a flu shot? Because I don't take the flu shot. I'm not going to take the flu shot, so why would I take this shot?
I think it was the lack of giving us knowledge of, that as in the medical field, that this is something that has been being studied for a while now. And so at least give us that type of information, because the lack of the information, and then we're just being herded in to stay inside and whatnot, you know, to me, that built a lot of fear, you know, and you could see it, and that just causes a whole lot of community trauma. And we're still, you know, that those after effects are going to keep going on for a while. So I think the lack of knowledge, not necessarily that it's the quicker they came out with the vaccine, that didn't surprise me, because the medical field is always expanding. Something is always being learned, you know, in that respect, and things are evolving, which is the natural way things should happen. So I wasn't really surprised about how fast it came out. I was just really surprised about the lack of knowledge and information that they were giving to the community as a whole.
So what factors did you consider when deciding whether or not to get vaccinated?
I think my most important, or the thing that kept coming to the mind, was obviously the safety of my family. Being that I work in healthcare, you know, the thought of working with someone who possibly had it, and then I come home and give it to my wife or to my children. It was a real concern for us. Actually, my wife also works in healthcare.
Okay.
So
you're both frontline workers.
Yeah, and
so you're exposed to a lot.
Yes, we're exposed to a lot, knowingly and unknowingly, you know. And so, yeah, it was just, you know, it was one of those, especially early on, you know, you were hearing about people losing both parents. And so, I mean, the concern was really just safety of my immediate family. And then, of course, my extended family, you know, parents and that nature. So I think that was what, you know, I spent most of my time considering.
Okay, so it sounds like your factors were your family member. That was your why.
That was
your
my
family,
why, definitely.
You know? Okay, yeah. So just one of my major things, like I said, is just the fact that it's not FDA approved. You know, I don't want to consider myself like a guinea pig for anybody. I haven't even gotten the flu shot. So it's like, I just want to make sure that everything is safe. But you know, I'm also like, I am very happy that we are moving towards a progression, like to do something, and it will die down like the number of cases. So I'm excited about that too. But just to see like how everybody's kind of coming out of it. I know that some people that have taken the vaccine, and I know people that aren't taking the vaccine. I know some people that are, like, they're having the side effects from like Moderna, the Johnson & Johnson one. It's just like you have to think about your overall health. I also read something about like pregnant women, like how it was some of the women that took the COVID vaccine, and how it's starting to make antibodies for the infant, and may not last in long term, but it's starting to work with antibodies and stuff. So I was like, okay, cool. Like this can be passed down from like mother to child. You know, some of it is working. But it's still, a lot of it's still up in the air. A lot of it's still questionable. So it's like the fact that everything is not written in stone, and the fact that like we're still trying to figure it out, is kind of what makes me like in the middle.
Just maybe more facts. We still don't have all the facts, you know. We get facts on the mainstream level, but I still just myself believe that there's more knowledge and facts, more information out there. And with that being said, instead of us getting and receiving that information, that, you know, you're separated from your family, your herd, your people, so to speak. And once, you know, we see that in nature all the time. Once you see that happening, the natural reaction for any individual, or two individuals, or a small group, is going to be a certain amount of fear.
It was a lot, right? Time, number one. A lot of people that I respect took the shot. And were advocating. The fact that almost everybody that I know that deals in medicine that is African American or Black was advocating that we shouldn't be fooled by what was going on. Also, I saw that there were shortages in other. I live in California. You know, we get everything. We're a blue state. You know, our thank God our state loves us. Our county loves us. But Detroit, you know, Texas. I was looking at their numbers, and there is disparity. So what I saw, and that with that, and then what actually I did make a decision, and I'm still, I it was a inner battle, and because I believe that there are two ways. There are two ways to problem solve it. Right, one way is you're going to not get the shot, and you just prepare yourself. You wear your mask. You do the 6 feet distancing. You do a lot of disinfecting. Right, making sure you use healthy disinfectant, not the toxic stuff that everybody has out there. So there is a problem solving way. There's a way of doing it and coping and dealing with that, but my daughter has asthma, and she is now taking food around to people, one of those she delivers, and her asthma becomes a risk factor for us, right?
Okay, so I guess it's the moment of truth then. So did you or did you not get vaccinated?
So yes, I did. I did get vaccinated. Um, I got vaccinated back in December. And my first, the first shot that I got, what I experienced was just soreness in my shoulder for maybe 2 days. And then about 3 weeks later, I got my second dose. I did the Pfizer through my job. And on that one, I know studies say that about 20 to 30% of people may experience some type of side effect.
Right.
And so the what I experienced was that first day, I think I just kind of felt feverish and just kind of laid around. The second day I had a headache.
Okay.
And then the third day I was fine. I was back at work. So I had a couple of days. And I think my wife's experience, she received the Moderna vaccine, and she basically had a day of just kind of feeling a little tired, a little feverish. And then she had a sore arm, of course. But other than that, that was our experience. So it wasn't terrible.
And it wasn't like some of the heightened hysteria that you hear on the news, where people are fearful. Because I know that was one thing, that was real. People were very fearful that they were being given COVID by being vaccinated. That was a real fear. And I think that it was because of things that were being stated in media, about people's reactions to the vaccination.
But I will tell you the thing that really did it, and I did get the first shot. No, I did it because I want to be out in the streets. I am so sick of this quarantine. I want life back. And I decided that I started hearing a lot about people who got COVID, didn't really have any issues, but then things started happening to them. I'm starting to hear about people that are having heart issues and these other issues, not during their COVID bouts, but after. And that's what tipped the scales. I believe immensely in quality of life. I work out, I eat healthy, I try to live a healthy life. And if I contracted it in everything that I do, I was not guaranteed that I would just recover, which I knew I'd recover, but then I saw that there were things, and it could be dilapidating and, put me into disability. And that was the thing. Now they guarantee us, I'm still, hesitant, but they say that, we won't get hospitalized or die if we contract COVID. So that to me means that it won't attack my body as ferociously if I have the vaccine as if I didn't. So I'm taking that precaution for longevity and quality of life, and because I need to, be careful with my family and others that I come in contact with.
I have currently decided to wait on getting vaccinated. I have friends that have gotten it, family that have gotten it, and they've had positive experiences. I've had a couple people that I know that have gotten rashes, or they're tired, or like the second dose of the Moderna one kind of like hits them a little bit. I've been hearing a lot about that as well. But you know, I'm all just happy with the fact that we're all just like going as a people, like the different perspectives, like that, like helps me to decide, and the fact that I still can decide. I don't necessarily think, because I know that they're talking about making it mandatory, I don't think that that would be a great option, because I don't want to be forced to take something and then it's like a year or so down the line, like, oops, there was all these side effects, but you forced me to take that. You know, it's like, it just really makes me worried, especially because, you know, I am an African American woman in this day and age in society, and a lot of medical things happen to African Americans at a higher rate a lot of times when it comes to like medication and stuff like that, or just like in the maternal department. Like there's a lot of risks that we take on. So I just rather wait a little bit longer. But like I said, I've had friends and I've had family that's taken it, and they seem to be doing just fine. So right now I'm just gonna wait a little bit longer, but eventually, yes, if it gets FDA approved and everything looks to be fine, then yeah, I'm definitely gonna take it.
Now let's talk about,
not at this time. Yeah.
do you mind sharing with me why you've decided not to get vaccinated?
Part of that again goes back to the lack of knowledge. I sit on a health board, and I've asked, you know, certain questions regarding, you know, the COVID and whatnot. And it's pretty much, I just get a general answer. I also, another factor that comes into that, I don't think is being, in my eyes and what I can see as of right now, there's not been enough research on how it's going to affect the African American community, the Black community, the, you know, the people of color, because we do have, again, typically higher different conditions of, you know, health factors, health risks, and things like that. I myself, I try to, you know, eat as healthy as possible, you know, do the things that are going to be conducive to my body and my health, to make sure that I'm kind of up here, you
Right.
know, on that scale. And again, I'll go back to say that I've never had the flu shot. You know, I have family and friends, oh, you, especially mom, oh, you need to get the flu shot. You're getting to be such and such an age, you need to get the flu shot. And I'm just like, no.
Do you have any other like closing thoughts or insights that you'd like to share with the Black Facts audience as it relates to the COVID in general, or the COVID vaccination?
I just think the different perspectives are always welcome. Like I love like talking to my friends that are like adamant about, you know, getting the COVID vaccine and then still staying like indoors, because, you know, a lot of people are getting COVID because, you know, summer's coming around. We've been in quarantine for over a year. They're just ready to get out and have a party out in town. You know, I have friends that are like, I'm not getting the vaccine. I'm still going to stay indoors and just kind of wait till everything's over. And I just love getting all that different perspectives. And I just hope that we as a society and a community can just kind of come together and listen to other perspectives and not just really push on one another, because I think we can all just learn all together from that and just, you know, move forward. Because this is, I mean, COVID, this is the first time like COVID's been like a global pandemic. So this is our global pandemic for our time. Hopefully the only global pandemic we'll have in our time. But yeah, so I just think that just listening to one another and hearing perspectives and then just making your own decision and people being okay with the decisions that are being made, I think will just help us all grow and move forward in this time that we have in front of us, for sure.
I'll just say, you know, from woman to woman, sister to friend, tribe member to another tribe member, just do your research, do what's best for you. Do what's best for you, because no one can live your journey.
Absolutely.
Again, my opinion may change somewhere down the road, or it may not. But however, I'm still okay with where I'm at, and just try to, you know, live your life as healthy as possible. And again, do the research for yourself and let that be your deciding factor, and not necessarily be all end all of what somebody else is telling you to do or what somebody else is doing or what someone else is promoting, because a lot that what's good for the goose is not always good for the gander.
Yeah, I would like to say that this is really an individual decision, and that no one should try to pressure anyone into deciding what is best for them and their families, right? I'm very, very worried about an option of maybe having a vaccine passport system going on, and hoping that we as a group will advocate against that so that we do have that right of choice. And following words, stay tuned, keep, your ear to what's going on, and be vocal about where we stand as a community and what's going on.
Yeah, you know what? I think just this entire environment for the last several years, and actually, last probably 4 years, it's been a really tough time, I think, for all of us as Americans. It's been definitely very challenging for us as a Black community,
Yes.
people of color. So I think it's important to approach this topic as well as others, being non-judgmental. We've seen families break up, because they fall on one side or the other.
Right.
At the end of the day, we all just want to be safe. We want to be healthy. Um, we want to be informed. We want to be heard. And you want to feel like, that you're listening and people are listening to you. And then, like we just said, as far as getting information, just using reliable sources,
Yes.
and not just taking one person's experience, realizing that, as a community and as people, um, we have different experiences. And my experience with getting the vaccine may be completely different than someone else who's gotten it. Likewise, someone who hasn't. So just having grace, man, having grace and being able to walk in someone else's shoes during this time would be the message that I would leave.
The fight to keep our community safe is not over. Now we are being confronted with the Delta variant. You're probably asking yourself, well, what do we do? Blacks have a higher rate of chronic diseases, so we can start by making healthier choices, moving more, eating better, so we aren't as susceptible to COVID-19. We also need to seek medical care at the first sign of an issue. Improving our health outcomes will require addressing our distrust in the healthcare industry. We must advocate for ourselves and our family members to ensure we are getting quality care. We, the Black community, have a lot of work to do. However, we are resilient. We must do our part to keep each other safe. I want to thank all of my guests for their willingness to be transparent and share their perspectives on the COVID-19 vaccination.